So welcome everyone. I'm José Luis Fernandez. I'm Director of the Care Policy and Evaluation Center. I'm a fellow as well of the School for Social Care Research, and welcome to this capacity building webinar. Today, we're really lucky. We're going to learn about the way in which clinical research networks can help social care researchers and how to interact with them. And we've got two speakers. We've got Becky Dilley from the Clinical Research Network in Kent, Surrey, and Sussex, and Julie Mugarza. I'm going to pronounce that at the Spanish style, research delivery manager from the Clinical Research Network of Northwest Coast. So without any further ado, I think they're going to talk about 40 minutes, and then hopefully we'll have plenty of time for discussion. Which of the two of you wants to start?
Julie's going to start, yeah.
Julie, go ahead. Thank you very much.
I'll just share the screen, Julie.
Great, thanks very much.
Can you all see that?
Yeah, that's fabulous. Thanks, Becky.
Great.
So if everyone can hear me clearly, so
yeah.
Hi everybody. So I'm Julie Mugarza from the Clinical Research Network Northwest Coast. We're based over in Liverpool, and we cover a big geography of about 100 square miles. So we're quite a big network. What we're going to do today is we've divided the presentation into two halves, really. I'm going to present the first sort of 10, 12 slides, and then I'm going to hand over to Becky to present the latter slides, and then we'll discuss, really. So just to give you an overview of my background, so I've been in research most probably about 23 years. I started my career really as a nurse. I was a ward manager on a medical ward, and then I moved into research as an academic, supporting a big research grant for a number of years. And then I moved over between other jobs, I moved then over to the Clinical Research Network, again as a nurse, to support delivery of lots of different studies. And then I moved over to and sort of dropped my front-facing role and moved over into as a research delivery manager. And the research delivery manager's role is very much around supporting research in lots of different areas, including social care and public health, to deliver research on the ground. And Becky and I'll talk a little bit about this over the next sort of half an hour or so around how we do that. That's great. Thanks very much, Becky. Next slide. Okay, fabulous. So we're going to cover a few things. So we're going to cover how does the CRN, what does the CRN do? And then we're going to talk about a little bit about how do we operate? And then we're going to talk about how do we all engage to maximise on the opportunity to gain support from the Clinical Research Network. Next slide, thanks. So relevance to the social care. So I think, you know, I've been involved now in the clinical, and I use clinical with inverted commas very much so. Certainly when the networks came about, and the very first network was the Cancer Research Network. We're talking about almost 20 years ago plus. It had very much a clinical focus, but I think that is changing, and I think hopefully yourselves and us at the network can help to make that happen. So we're looking at what we have currently, and we're looking at how we can develop that moving forward. And what we do have now is Geraldine MacDonald, who is an academic from Bristol, and she is a social worker by background, a professor in social work, and she has been tasked by the NIHR to lead on that social care landscape and see what we need as a network, and I'm dropping the clinical there, to move this very important area forward. And certainly Becky and I, from our perspective, networks, me in Northwest Coast and Becky down south, are the lead people within our networks to try and help that to happen. We do other things on top of that, but that's primarily why Becky and I are here today. Certainly it's based on support that we give to the NHS settings, but we know that it's different for social care. The language needs to be very different if it's to be maximised and understood. And it's not just the language to yourselves, I think it's language to our colleagues based in the network as well. Predominantly a large proportion of our budget is based in NHS service, and it is going to take time to change that speak, I think. I think what we want to do today is to present to you, but we also want you to tell us what we don't know. You know, we're trying really hard to do what we can, but actually we need that work. We need that working together to make it work in both the shorter term and the longer term. And just let us know what would help you. Thanks, Becky. So this is the National Institute of Health Research. It's a big beast, without a doubt. It's the largest UK investor in health and social care research. It's many hundreds of million as an infrastructure. As I say, it's predominantly been focused very much in the past on clinical research, but that is changing. And we know that research active organisations, whatever they may be, and there's research to support this, whether it be in a GP practice or a hospital, and perhaps less so, and that's hopefully, you know, if we look back in this in 5 years' time, perhaps we'll be able to say the same for social care. But we know that research active organisations produce certainly better health outcomes, and I talk about health in its broadest sense. And we know that investment in research from a UK PLC generates more income and more investment. And I think never has that been more obvious than over the last 8 months, when we've all had to rise to the challenge of COVID-19, not just about treatments and potential vaccines and diagnostics, but also about actually how do we, you know, impact and support children in schools and people who, you know, residents who live in nursing homes, and all those kind of different, really broad, you know, it's important that we're doing research. And we know, you know, it certainly, having been involved in research, it's important to the participant, but also it's important to us as professionals. You know, certainly, you know, when we go for recruitment, we know that when we recruit people into these kinds of roles, for instance, in the Clinical Research Network, actually, if organisations are able to say, you know, we're cutting edge, you know, we're moving with the evidence, then actually such things as recruitment and selection, you get a better quality of candidates. So there's lots of reasons why driving research at whatever level is important. And I think, you know, hopefully all of you are going to help contribute to that moving forward. Thanks, Becky. So the National Institute of Health Research commissions and funds health and public health and social care research that is essential for improving health and wealth of the nation. And that's what I've tried to demonstrate just in my last few comments, really. I think it is really important. It is a massive platform for growth, really. Interestingly, you know, sort of, you know, purely from a clinical perspective, it's the only part of when we talk about NHS infrastructure, it was the only part that was most probably ring-fenced and protected by this government and previous governments, because we understand that research is pivotal at any level, really, to help move things forward. So thanks, Becky. Next slide. So how can we help? So there is a big structure for the NIHR research, and the clinical research networks are part of that structure. So we receive a budget. So Becky will receive a different budget in her network than I do in Northwest Coast. And we're tasked as a network to support the recruitment, the identification and consent of participants into research. So that's what the research networks do, the clinical research networks, as they are currently termed. Whether that will change as a name for us in the future, I would like to think so, but we'll have to watch and wait, really. The research design service, again, are another piece of that infrastructure that can help and support the design of research that is important. And it has lots of different elements to the RDS, from linking in with people who have a research idea to supporting that academic or clinician or person who sits in a local authority setting, whatever it is, to look at to look at, you know, has that question been answered previously, all those kind of things. They look at the design of studies, and they have statistical people employed by the RDS to support that kind of process. They have small pots of money to support what we call patient and public involvement. That historically, you know, many years ago, people designed studies because it was an area of interest and they thought it would be good to do so. And you know, I think most probably historically lots of public money was utilised where actually some of those research questions maybe weren't as pertinent, as important as they perhaps could have been. So actually very much now when we look at designing and when grants are awarded, they very much look at, is this an important research question to the person or the population it serves to answer the question for, really. So there is pots of money, only small pots of money, to try and encourage people who are designing studies to ask those questions to that population that they are hoping to you know, explore, really. So there's lots of things that the RDS do, and there is lots of things that the Clinical Research Network do to support grant applications. Obviously within universities, there's lots of different structures and organisational research offices that again support people to deliver and design studies that are of good quality. And there are lots of such things as a clinical trials unit, CTUs, and other partners of the NIHR structure that will help that grant applicant. Thanks, Becky. So what is the structure for the CRN? So we have 15 networks in England, and the devolved nations have slightly different structures, and all of those networks are in, you know, they're not certainly of similar size because we all have very different populations and we all have very different budgets, but in essence, certainly within North West Coast, I have my network runs from the sort of South Lakes down to South Cheshire. Manchester is a different network, and West Midlands is a different network. But I cover, from a clinical perspective, and I know you're not a clinical audience, but I cover 19 CCGs, which are the care commissioning groups for general practices, and I cover 20 plus acute or specialist care trusts. And within that, I have many local authorities that that we work with, or we're trying to work with. And interestingly, last year we all received, so Geraldine MacDonald was given some money to look and invest in understanding what that social care landscape looked like in England. And we all bidded for various pots of money and for various projects, but we all received a pot of money, and certainly within North West Coast, what we use that pot of money for is that we commissioned a large mapping exercise of the social care landscape within North West Coast, and that was finished in April. Unfortunately, then COVID-19 hit, and obviously our focus has had to be that the normal things that we would like to have spent our time on over the last 6 months have changed, and we've had to, and we are in the process, you know, Becky and I are involved in 4 vaccine studies, 4 vaccine meetings a week around the stuff that's coming through currently. We are really busy with COVID-19, but I hope and I pray over the next few months that will be very different, and we will really be able to grasp that piece of work, certainly in North West Coast, and I'm sure Becky is thinking the same, grasp that piece of work that was done and really try to maximise on the potential of that work, so that we can really, certainly in North West Coast and the other networks, start to engage a lot more with this landscape. So we have 15 networks, we're funded. So I think this is one of the key challenges, is that currently our infrastructure for support talks about treatment costs, it talks about NHS treatment costs. And I was involved only 2.5 weeks ago with a roundtable with Geraldine MacDonald and the Department of Health and Social Care to look at actually what needs to be different to make and to ensure that we fund social care research effectively. And certainly DHSC took back quite a lot of key points around the fact that currently our infrastructure for the Clinical Research Network, and it's we have a key finance document called the Accord Guidance, and that Accord Guidance talks very much about NHS treatment costs, and that needs to change. You know, that really does need to change, and hopefully some of those key messages that were taken away will hopefully help to influence that agenda moving forward, I think. But yeah, you know, I think at the moment, you know, there is a big sort of push to change that. Within each of our 50 networks, Northwest Coast and Becky's, we have the structure is a national infrastructure. We have 30 specialties, and they're such things as primary care, public health, respiratory, cancer, lots of different, you know, clinical specialties, but we have public health, we have social care, and we have primary care that perhaps are the most pertinent, and also health service delivery research, which perhaps are most pertinent specialties for this presentation, really. Thanks, Becky. So this is the structure in England. I'm number 2, and Becky, you're number 10. I think 10, yeah. If my geography is right.
Very good.
Yeah, yeah. So, so Becky's based down in Kent, Surrey, and Sussex, and I'm based in Northwest Coast, and we very much link. We link regionally with lots of academics and people within our geographies. But actually, I think what the next works really truly bring is that collaboration. So Becky and I have been, I think, on most probably half a dozen meetings in the last week alone. So, you know, together. So we very much, so if you are designing social care studies and you're based in Liverpool, then that's absolutely fab. I want to work with you and I want to support you. But actually what it also brings is if you say, well, actually, I want to do it in, you know, in London as well, where there, you know, if it's a focus study around homelessness or something very specific, then I can link you in with my counterparts across the whole England geography. And I think that has certainly, you know, that's one of the really important parts of the CRN that you know, and never has that been more evident than over the last 8 months, I think, of people working in collaboration. Thanks, Becky. So the aims of the Clinical Research Network are to ensure citizens and health and social care staff from all parts of the country are able to participate and benefit from quality health and social care. And that's a little bit about what I said, really. It's about integrating the care and you know, so you as an academic that might be designing a research study and a research question that may be really pivotal, important, but you don't know or don't have the contacts with those kind of people to get the study out there. So that's where we can, you know, that's where we want to help, really. I think what we do is, you know, in years gone by, I remember setting up studies, and certainly my piece at my MPhil myself, I had to go to something like 100 ethics committees to get approvals, and it was an absolute logistical nightmare. The whole point of the local clinical research networks was to try and streamline some of that process, and certainly that has helped. I think around the social care arena there is still some work to do around some of that governance work, and I think people on the ground are trying to do that, and certainly as networks we're trying to streamline so things are made as easy and as quick and as lean as they possibly can. But there is certainly still some work to do. And yeah, I think it's about, you know, I've touched upon the fact that, you know, funding it comes from lots of different resources, really, and I think it's important that we try to invest in the social care landscape, just as we have over the many years invested in the NHS and the clinical landscape, really. But there is still some work to be done, and I'm sure you all appreciate that. Thanks. So the way that our funding comes through as a network is that we have, so a large proportion of our budget is based on population, so the amount of people that sit in our geography, but actually a proportion of our budget is also based around what we call activity-based funding. So we shouldn't say points made to prizes, but to a certain extent it does. One of the things that happens is that, and we would really be strongly encouraging you to can think about and link in with the likes of Becky and myself in your respective networks, is to think about portfolio adoption. And portfolio is, so it is basically a collection of high quality research studies that are eligible for consideration for the clinical inverted commas research network. You know, the more studies we have on portfolio, the bigger slice of hopefully the pie we have to invest in, you know, some of those studies. So the networks very much fund, as I said earlier, the identification and consent process if your study involves a consent process. So the money that we get, we would flow out to a site to support your study activities. Obviously, behind that, there would also be a research grant that would fund the research activities. And we can talk about that in a little bit more in detail in a few moments, but it is very much around thinking about portfolio adoption and trying to get studies onto portfolio so that we can really support that structure moving forward. And I think there's lots of other hidden things around portfolio adoption, such as, you know, is seen as sort of the gold kite mark of quality. If you are if you're an academic who are designing a study and you get an NIHR grant and that study goes on portfolio, you know, it's hopefully, you know, it will be recognised in years to come, you know, the quality of that piece of work. So, but yeah, thanks, Becky. Next one. And I'm sure I obviously don't know the experience of the audience, so I apologise if this is teaching people to suck eggs, but I think the aim of this slide is to talk about the fact that actually the network can feed into lots of different elements of this. So obviously there's the likes of the RDS and there is the likes of ourselves. So we do lots of early contact and engagement work to support people who have a research idea but don't know quite how to make it happen. So, you know, helping that kind of element. And we do lots of work around thinking about the study design. Certainly, you know, so I cover a number of specialties. I cover primary care, I cover public health, I cover health service research out of those 30 specialties. And I also have the badge of social care lead for North West Coast. But I spend lots of time linking with those specialties, and people say, this is what I want to do, but I don't know quite how to make it happen. And we sit round tables, or we used to sit round tables, now we sit round Teams or Zooms or whatever it might be, to try and advise and to try and guide people through that process. Part of our role is also around managing research. So when studies get on portfolio, and we have a role to support actually how that study is performing. Because what we don't want to do is just support you through the early process, open the study, and you know, you just roll along, and then you start to have problems. So, but we very much try to, we say performance manage, it's not so much performance manage, but we try to help and support that process around how a study is performing. And you know, if a study is particularly struggling, then it might be that we need to think about and support you with opening it farther and wider, and we can help you to do that. So we very much have a role as a lead network, if that study is run out of Liverpool, to performance manage and support you with that. And there's lots of things, you know what I mean, analysis and interpretation, impact, certainly. I think where research has always come to has always fallen is around the dissemination of evidence, isn't it? Whatever that might be. And part of our role is to try to help also people where they have celebrations and successes and papers, to try and help us, you know, the NIHR will help you to do that and sing from the rooftops, really. So it was just to demonstrate that, you know, CRN isn't just about one element, it's about the whole cycle, really. And these are the different funding, obviously funding programs that are very much NIHR funding programs. So research for patient benefit, you know, there's lots of different public health research, HSDR, they have an annual call, all these kind of, you know, sort of elements of research are NIHR funding programs, tend to be quite large sums of money. And my experience, and I don't know about Becky's experiences, but actually to get an NIHR funding program is really, really hard. You know, I think we have to be realistic with the successes of this. And, you know, I take my hat off to different academics and clinicians and across the board, you know, because, you know, I think sometimes they say, you know, 1 out of 10 grant submissions successful. So I think there is lots of work to be done, but as a network, we're happy to try and help those grant submissions with different elements, so that hopefully, and we can buddy up people both regionally and nationally if necessary, so that the grant submission is a bit more meaty and linking in with all the key elements that grant submission is requesting, really. So thanks, Becky. Yeah, and these are just a couple, you know what I mean. The RFPB has that annual call for RF social care funding, which is a yearly thing, and the HSDR program again is one of the key elements of funding that can support yourselves with some of the potential successes, really. However, I think the next slide, okay, that's one after actually. So yeah, so there's a large amount of funding that is put into the social research landscape. Perhaps, I'm sure some of you would say not enough, and to a certain extent, you know, I think Becky and I would most probably agree with that. But there's lots of things that, you know, can help and support you to be successful in that landscape. And I'm sure, you know, you're sort of Joseph and people on the ground at helping some of you guys to be successful around some of these areas. So next slide. I think this is perhaps one of so we are the NIHR, we are the Clinical Research Network, but actually what Becky and I and all our equivalents try to do is, certainly there are multi-million-pound grants, but actually to get onto portfolio and to get the support of the CRN, it does not need to be a large grant. It can be a small charitable amount of funding that has been open to national competition. And I think this is where historically most probably we have missed out on the opportunities of getting things on portfolio. So it needs to be within, to get portfolio adoption, there's a few different things. There is that some of your funding was open to national competition, and there is a peer review and a national peer review process in place. And they're the two key elements that get things onto portfolio and get you access to the CRN, really. And I think some of these elements, you know, to me, could be small pots of money. Certainly in the likes of public health, for an example, certainly historically, a lot of the public health fellowships historically never got onto portfolio. But actually, when we've done work locally with some of our public health colleagues, and we've gone back to the original grant award of that, perhaps, you know, I don't know, 600,000 to fund 2 PhDs. Actually, the original award was open to national competition, and if that can be demonstrated, then everything underneath it most probably can go onto portfolio. And I think that's most probably one of the key things to take away from today, is that actually if you're not sure, just speak to us and let us have that conversation, because I think there is lots of opportunities that are most probably missed. And it's not just the social care landscape, that's across the board, I think. When we link in with higher education institutes across the, across all our lands, across all our geographies, really, there is lots of things that could have potentially got on portfolio that have failed to do so, unfortunately, because people haven't realised, perhaps your supervisors haven't realised that is the opportunity that's open. So yeah, thanks. Next one, Becky. So I think it's over to Becky, if that's okay. I noticed there were a couple of, should I just pick up, let's have a quick look in this chat, because I know you couldn't see Becky. So how do we find out what the equivalent structure is in Scotland? Is it under the UK CRM? Because I cannot find it similar to what you were saying. Can you provide me with the URL or the email where I can chase this? Yeah, most definitely. We can support you with devolved nations, and certainly Geraldine MacDonald links in with those devolved nations, most probably more than Becky and myself, but certainly we can do that. Yeah, someone's put the RDS link in, which is great. Thank you for that. Yeah, you've talked a little bit about the devolved nations. Certainly what we can do is we can most probably, Becky and I can pick up with Geraldine, post this presentation around some of the devolved nations and maybe send some information through to a central point that can be sent out to everybody far and wide, if that seems sensible.
That'd be great. Thank you very much, Julie.
Okay, no problem. Great, over to you, Becky.
Thanks, Julie. So a really great introduction to the bit of the background of where we come from and the kind of general support. So I'm just going to go and talk a little bit more about some of the specifics, and just from the outset want to reiterate what Julie said, which is that yes, this is an example of what we have done in the past and what we can offer, but it is not exhaustive, and we certainly are always on the lookout for ways in which we can support any research, even if it's slightly differently to how we have. We kind of need to know what we don't know so that we can start to adapt the offering really to support colleagues working in social care research. So if there's something that you need support for, that you'd like support for, that's not on this list, that doesn't mean it's not available. It might just be we don't know about it, or we haven't thought about it, or we haven't come across somebody who needs it, but it doesn't necessarily mean that we can't help support. So just to frame what I'm going to say next with that, just to reiterate Julie as well. So yes, as Julie said, we're not just clinical. It's in our name, which is really a shame. And it just is the history of where we've come from, as Julie said. So, but we don't just support clinical research. And in fact, the support for social care research is very much growing, and very quickly, actually. I would say it's getting up and running much more quickly than the support for NHS health or clinical research did initially. So, and there's a great momentum behind it, and there are a lot of us that are very, very passionate about it. And we really want to see us able to make an impact. And in order to do that, like I said, we need to know what we don't know, but also we need to know about you guys and what you want to do, what you're doing, what your thoughts, your questions are, what research you've got ideas about. And so what we really do say is come and talk to us early. You know, some people say, almost at the stage of you get out of bed in the morning and you think, bingo, I've got an idea. Come and talk to the CRN. It's not too early. It might be that we actually signpost you to other people initially, but we want to know about it because we want to be thinking how we can support. And actually what we'd like to do is have joint conversations. So if we're going to maybe point you in the direction of the research design service, quite often we'll have those discussions all together, because then you're not repeating yourself, you're not having to introduce yourself and your project to lots of different people from the outset. Everybody knows, and we can all feed in with the areas where we can best support and know what each other is doing. So come to us as soon as you can. It's never too early. And just to say that we support any research, no matter where you are. We'll find someone to help you, no matter where you want your study based. we'll find some way to help. It doesn't matter what the size is or what the focus of the study is, but there are some criteria that it does need to meet in order for it to be able to go onto the portfolio. So the second one there, Julie's talked about funding. So it needs to have enough funding to cover the research cost element. And there's this guidance document that Julie mentioned called Accord. It's got a long name. As you know, everything is acronyms. And this is basically allocating where different costs to do with research should be paid from. And that is one thing that the CRN can really help you with, is demystifying that, taking away the worry about it. It's almost, you need to know that you need to know about it, but you don't need to know what it's telling you to do or what it says. Come to us and we will help demystify that and work you through it. The research has to meet the Department of Health and Social Care's definition of research, and I'm pretty sure you'll get a copy of these slides, and I've linked it in there so you can go and see what they say research is. And it does need to have appropriate ethical approval. That's appropriate approval, so it depends what's needed for the type of study that it is or the piece of research that it is. And most likely it will need, your research will need you to apply through the integrated research application system. Not always actually, but if it does, then it's really important that certain things are phrased and approached the right way. And again, that's somewhere where the CRN can just help you. You don't need to worry about it. You just need to know to come to us and we'll sort it all out and help you through it. So early contact is key because of some of the things that we can offer you. And I've just put here about it being a bespoke service to meet your needs and the needs of your study. And that's really what we feel really passionate about, is it's not just one size fits all. There are slight differences between how the different networks support, between how we're configured, between the job role name that you might go to, but essentially what we all want to do is provide this really bespoke service to meet your needs. And so this early contact part is generally before funding has been awarded. And so we can help with letting you know if your study will be eligible for the portfolio, helping if you need it with any review of the design, although the research design service does that to some extent, but we would look at it from a deliverability point of view. I love that word because I'm not even sure if it is a real word, but I use it all the time. Can this study actually happen? Do you need any help knowing that whether this will happen or not? What are the recruitment pathways? Have you got them nailed? Because if you don't know how you're going to find people, you don't then know that you've costed appropriately to find those people. And we have, I know Julie will have as well, worked with many study teams in the past where a study is funded and opened and suddenly we can't find people because that recruitment pathway hasn't been looked at. So we can help with that. We talked about the costings and the attribution of those costs. There is a form, which again, another wonderful acronym called the SOCAT. Some people call it the SOECAT. It looks horrible, but it's not. It's a tool. And it actually, in a lot of instances, there's nothing really that needs to be completed too much for that for social care type studies. But we will work with you again to take the mystery out of that and help you with how to complete that. That if you do need to submit a SOCAT, it does have to be validated by the network. And that's another good reason to link with us early, because sometimes it takes us a bit of time to be able to get through that if we have lots of questions. We can help advise on regulatory submissions and locally. And again, this is where we can speak for our own region or put you in touch with people from other regions about how delivery of that study can be optimized based on what the local picture is. And if you need extra support to involve the public, citizens, experts by experience, then we can help with that as well. And the Research Design Service, we would work with them around that too. So a kind of second strand of the support that we can give is for the actual research setting. So where the research is actually going to take place, we can support with training and resources to support you guys. So we have training in Accord and the SOCAT. We have training in good clinical practice for research, if that's what you need. There's a whole suite of training that you are able to take part in, and also for social care staff as well, who may not have been exposed to research and the concepts of research. And actually, one of the things that we and colleagues in other networks are doing is trying to develop a suite of resources that can be used by social care researchers, social care staff, people in settings, and actually that could be used with potential participants as well. And we're starting to pull that together, and hopefully that will be available for people to use soon. We know in some regions they already have something, and so it's in development. I think the idea is that will be available nationally for people. We can help with recouping some of the costs for a setting that's taking part in a study. This is difficult because of the terminology and the language that's used in that accord document, which Julie mentioned earlier on, and talking about treatment costs. But there are other types of costs called service support costs. And this is the sort of activity that's related to participants that wouldn't continue at the end of the study. Now, in some cases, it's a bit vague as to how that would be able to be supported in social care, but we do it. We don't have a separate budget for it, but certainly in my network, I put money aside in my budget to support social care research. So it's starting to be available. Possibly not everywhere, but that's definitely a conversation to have. And if it's something that becomes a momentum of what's needed, and Julie was talking about these links back and having these meetings with the Department of Health and Social Care, that money needs to become available. And the only way we can really pressure for that is by you guys telling us that you need it, and us making that argument. So it kind of needs to be that groundswell of support for it that can then propel it forward. And we can connect you and connect different research settings with a local network of researchers. So we're starting to get a picture. Julie spent some of her funding on pulling that all together. We have a picture locally. Everyone started to build up this picture of who does what. And so being a network, so forget the clinical bit of our name, let's focus on the research and the network. And that networking is so key, and we see it working for other specialties and see it working within social care as well. So we can help with setting up your study. We can help find sites. If you need care homes or homeless settings or whatever it is that you need, we can help with that. We may know people, we may not, but we're actually really good at picking up the phone and trying to persuade people to take part in research. And so it doesn't matter whether we've worked with that group of people before or not. We're willing to just go ahead. We'll learn from you and we will go and do that work for you. We can advise on permissions, we can liaise with sites, we can help support and train sites. And in some regions, staff do go into different sites and help actually deliver the study, either mentoring them or actually supporting with the research delivery. And we can help, Julie mentioned this as well, actually monitoring the performance of the study and making sure that it is meeting the timelines for recruitment. And that's something that we do for all studies, and social care research is no different. We would help support with that. So just to finish up, last couple of slides, just wanted to give some examples of some social care studies that there are out there at the moment or that have been being supported. So My Care is evaluating the impact of community engagement on care home residents' quality of life. This is a study where we actually had someone from our team go in and actually support the care homes to engage with the residents. And that was a really useful resource that we could give to the study, because the care home staff were saying, we don't have time, we can't do this. And so we said, okay, if you will allow us, we'll bring someone in who will do that. Bath Out 2 is looking at bathing adaptations in homes of older adults. There was a study looking at promoting good practice in relation to alcohol use in care homes for older people. And a study looking at support for victims of violence in the British South Asian community. And I understand there's a couple more recently funded research for social care projects that hopefully we'll be hearing about soon. And just in terms of the current situation we find ourselves in. So within the pandemic, there is actually a study looking at serial testing for care home staff and residents for COVID-19 and looking at the interactions between that. And so that's something that we are all feverishly busy supporting, and again with staff going in, obviously with all the proper safety, in order to support that, so that it takes the burden away from the care home having to actually deliver that. And then just to kind of bring to a close, just some of the things that we're focusing on that are real priorities for us, and be interested to know what priorities are for everyone else who's working in this setting. We really are still developing our offering to social care, and that's adult social care and children's social care. And we're really keen to know what we don't know, so that we can develop that offering, because we know it's different. We know it's based on health care, on health research and clinical research, but we know that's not where it needs to be. So we want to learn. We want to get to know people. That's one of the most amazing parts of my job, is all the different people and all the different things they're interested in. And actually that problem solving, I love that. How can we support? What can we do? Want to expand into the wider social care. So, you know, understandably, I think a lot of the immediate and the very instantly transferable social care research has been in care homes for older people, but that is changing, and we know that needs to change, and that is expanding, and we're excited to see how we can help support that. Particularly a focus around hidden and hard to reach populations. So obviously within the COVID-19 research agenda, there's a lot around the Black, Asian and minority ethnic community engagement with research, but also homelessness, and other hard to reach populations in general, not just around COVID-19. This is something that we had a big focus on prior to the pandemic. Obviously, we want to look at the use of technology, and lots of our studies now coming through are looking at how technology can support social care setting. We've got COVID-19 related research coming through, as I've talked about. And I think the ultimate goal, as well as that dissemination of research, is, like we said, that impact. How can we positively use these studies to influence policy change? So I think you'll get these slides. There's our contact details. There's the general National Institute for Health Research, social care email address, and then Julie's and mine. And just any questions. I think if I stop sharing the screen now, then we can take some questions, if that's all right. Thank you.
That'd be great. And you've so thank you very much for that presentation. That was really very useful. You've mentioned pots of money many times. You've offered many ways of helping social care researchers, and the opportunity to do new things. I'm sure we're going to have loads of people asking questions. If you want to do so, you can either raise your digital hand by clicking on the participants button and then raising your hand, or if I'm seeing you, just raise your human hand, and if I see you, I'll call you. Who wants to start? Catherine, do you want to, and then Martin. Catherine, do you want to ask your question?
Yeah, thanks for really interesting presentations. I think that one of the issues we found at Birmingham in kind of engaging with our very friendly and engaged CRN is when they say, would you like to sort of come on the portfolio and can we help you? Then I think we really want the help, but then it ends up feeling a bit like we have to do 10 other new things that we wouldn't have had to do otherwise. And I know a couple of colleagues are kind of going, do you know what, actually I don't want to be on the portfolio because there's all these kind of extra hoops that I'm having to jump through, and I don't think, you know, this doesn't feel like help. This feels like extra work. So I just wondered if you could maybe reflect a bit on that kind of balance and how we get that to kind of feel slightly different.
Yeah, I think that's definitely something that I would say we've heard as well and do understand. I think there is something that we keep trying to take back to our coordinating centre and to our own networks about how can we reduce this burden. I think the other thing that we need to do is really learn how to increase our offerings so that it makes it more worth your while to fill in those forms, because at the moment a little bit of it is actually we can't invest more in the research infrastructure in our communities until we have more research happening. You know, that it's almost like the funding has to follow the activity. So in part, some of it is a little bit of altruism and building for the future, actually, if I'm honest. But I think what we try and do is take as much of that burden off as we can. So for example, one of the things that we implemented quite early on in the whole support for settings outside of acute trust. And I include primary care in this because actually primary care doesn't always fit in neatly with the rest of the NHS either, or with the NHS, is that, for example, the uploading of recruitment activity, which needs to happen at a site level, we actually do that for our non-NHS sites. So we ask them to very easily send us just a spreadsheet of how many they've recruited, and we upload that for them, so that they're not having to integrate with or interact with the system. And I think it's those sorts of things where we can take a bit of the burden, hopefully will start to make it more worthwhile. But I think certainly if it's somebody within KSS, Julie, I don't want to speak for you, but I'm sure you'd be the same, we would want to really know those concerns so that we could really look and think how within our team could we help take some of those burdens away. It is something that we recognise. We know the system isn't yet perfect. And in a lot of places, they have a governance team, they have clinical research assistants, they have people who can do that for them. And we know that you guys and the settings that you're working with don't have that.
I think just to add to that, I think, so one of the pots of money that Geraldine MacDonald was given and then passed out to one of the networks was around the governance process. So actually there is some work going on the ground, and then we need to pick up post-COVID to look at actually what is a pragmatic approach to set up and try to, look at what we need to keep and what we need to get rid of, to make it easier for people to link with the CRN and support studies. I think, what's really interesting in over the last 6 months is where we've taken and from a clinical perspective, a year to set up a study. It's been set up in a week and a half, and you think, hold on a minute, you know what I mean? There needs to be, and I think there's probably lots of lessons that we need to learn. But I think we also need to understand what the structures are for social care, for your kind of research, and what elements you need to have in place, and then what elements need to come together. So I think there's some work to be done, but I think what we've tried to sell today is actually there is lots of positives of working with us and trying to work through this, to make it easier for yourself, Catherine.
Thank you very much. Martin, you had a question?
Yeah, it actually follows on quite nicely. I think, one of the key differences between working the health and social care areas is that, the vast majority of providers in social care are outside the public sector. Most of them are private for sector providers. And I think, my observation would be that the experience you got in CRN, you already previously have worked on clinical studies in care homes, but you won't have done very much in home care settings, in community social care settings. And so I'll ask a question, but I also just want to say something else before I ask it. Before I say something else, I want to say thank you for a fabulous presentation. It's really, very helpful. But my question then would be, what facility do you have for learning across your different regional networks? Because presumably, if then somebody does begin to learn how best to engage with these home care providers, which is not an easy task, it's not that they're difficult, it's just that the nature of the provision is more complicated. Can you then carry that learning across and help researchers across the country in that way?
Yes, is the short answer. We do. I think the COVID situation has somewhat limited our abilities to meet together as a group of people supporting social care research. But prior to March, we were meeting together on a very regular basis and sharing that information. And that is back to that networking part of our name. And I think certainly, I would actually say for social care, possibly more than anything else, because I think we know that we haven't been set up originally to support social care. We're even more likely to share that information and pick each other's brains and bring things to that group. So yeah, there are a lot of platforms for us to all meet and share those sorts of information. And I think as we go forward, we'll probably be doing that more and more.
And it might be useful to perhaps have that repository open to researchers so that they can see examples of how you can help them. Any other questions? I'm sure there'll be other questions. If not, I've got one myself. So there'll be people that have perhaps have got a program of work and are halfway through a project, but there's still significant elements of that grant, let's say, which potentially could benefit from your input. Is that too late for people to engage with you, or is that still, can they still talk to you about getting your support?
I think, yeah, so I think, you know, we have studies and as you say, programs of work, and certainly we have research that has been designed, maybe some of the early stuff maybe, you know, very much consolidating the question and things like that, and it might be the latter element that might involve interviews or something. So I think so I think you can get on portfolio at any point in time. I think if you have, and Becky can most probably direct me here, but I think there is a limit of 6 months remaining work, something like that, that needs to be, you know, if you would say to me, I'm finishing in a month, then that's most probably not suitable. But I think there is a 6 month timeline, and we can double check on that. And what you won't get is, what we can't capture is the recruitment pre-portfolio adoption, but we can capture the recruitment as soon as it gets on portfolio. At that point in time, we can support you, you know what I mean? We can, you know, and if there's funding that we need to flow through, we can flow through funding and things like that. So yeah, you know, I think if you're not sure, ask the question, I think, is the key.
Great. Dia?
Yes, hi. Thank you for this presentation. I also found it very helpful. My question is around, well, as you explained, you're supporting mainly the identification and consent of the participants. So in a social care project, how would that be exactly? Because I'm thinking in a clinical project, there will be research nurses that will go and look at databases and find and screen and consent patients. Can you give us a couple of examples of how you have managed to do that in a social care project? Thank you.
So we had, I don't know, Becky, should I just quickly? So we had a study called PALS, and PALS was a study that was set up for around loneliness and isolation, and it was set up in homeless organisations, the Whitechapel Centre in Liverpool, Crosby Housing Association, some of our charitable third sector organisations that provided support. And what we did to support that type of study was we worked with the study teams and went in and worked alongside them for a short while to try and help and support them, because they hadn't been involved in a consent process before. So they're the kind of things that you know, we can do. As Becky said, we can be involved. So if yours was a study that was open in that like kind of setting, and it needed an education element, but it needed to open in 3 other networks, then and there was a package of training, then we could perhaps go out and deliver that training to sites. So there's lots of different elements, you know what I mean, that aren't classical, you know, sort of identification and consent. We, as Becky said, we just need to sometimes think outside the box and see where the added value is really, and link in with yourselves when you're in the process of designing that study. Becky, I don't know if you want to, if you've got anything else to add.
Yeah, I would agree. I think, you know, there's the direct doing it, and then there's the supporting people to do it. And it does depend on what's appropriate for that setting, that individual site or organisation. And so we actually have used our research nurses to go and support that process, because they're the staff that we have. I would love to have a team of people who were experts in accessing social care settings, and that's where I'd like to be able to say, well, actually, you don't need a research nurse for this, you need this person, and here's somebody. But at the moment, what we have is research nurses, and that's what we've done. So we have had research nurses go into settings and, again, mentoring or actually helping to identify people and undertake that process themselves, so actually consenting and doing that. So it's, again, like, you know, like we've been saying, and like Julie just said, it depends on what's needed for the study, and we will do our best to flex what we've got to fit.
Thank you very much.
just to add to, sorry, okay. Just one comment. Ahead. So just, I think we may be running short time, but just one comment as well. So we are just, so every network has been given a pot of money. We're just about to go out for some local authority posts. Some networks are a bit ahead of it than others. So I think Geraldine has identified the need to perhaps change that workforce that we have, and certainly in years to come I would like my team to consist of people with local authority experience, people who are social workers, people who, you know what I mean, are involved in fostering and adoption or whatever it might be. You know, I think our workforce will be different. It needs to be different if the landscape is going to be different. So
great. Sadly, we've run out of time, but it's really fantastic to see the willingness to engage with social care researchers to shape the support that you give, and so I'm sure there'll be lots of opportunities for further interaction. Thank you very much for your presentation, which was great. Thank you.
Thank you, everyone. Thanks for the opportunity.
Bye-bye now.
Bye.